we'll help folks either connect with a mobile team, connect with 911 and a mobile team. We'll do three-way calling. We'll help them call their doctor. It's interesting. Lots of folks don't want to tell their psychiatrist or their therapist the whole story.
Yes.
So we'll help, facilitate that process. We'll help facilitate disputes between young girls who are getting thrown out of mom's house and mom, so that they don't become homeless. So all of those sorts of services to try and keep people in their housing, give them proper information about any issue, May being Mental Health Month. It's a good month to call about mental health issues and challenges, and then just linking them with appropriate services. And all of our services are completely free. They're just a phone call away. If there's a charge for a service that we refer someone to, we're aware of that and we let them know.
Okay. And anybody can call?
Anybody can call.
So all
and you can call in any language. We have AT&T language line services, so you can call in any other language, and we can get an interpreter and then speak with you. Last month we had some folks in Mandarin Chinese and somebody that needed to speak Polish. I do have some staff that speak Spanish, French, and Creole. When they're there, if someone calls, we have the ability to have somebody right on spot.
Wonderful. Is there anything else that we would like to know? Anything else that we need to know that we haven't covered in this discussion?
Help's a phone call away. It's really just a phone call away.
That's so reassuring.
Yeah, just pick up the phone and make a call to any one of the 3 agencies or any of the agencies we're connected with. Help is there. It's just a matter of figuring out a way to connect.
And we'll be scrolling these telephone numbers.
That's great.
On the screen for our viewers.
Thank you.
Thank you very much. Mr. Watson, we're going to go back to you because we've alluded to something called the network of care, and I'd like you to give our viewers a little more information on that.
Okay, well, the network of care was initiated last year to begin to provide local access to mental health resources and behavioral health care over the internet. And it's a network resource that can be used by consumers, family members, professionals on any area of mental health that they're looking for. So you can get information on legislation if you're interested in what new legislation is coming down the pipeline in Maryland to support mental health initiatives. You can get information, interpreter services, like Tim said earlier. You can actually find interpreters through the network of care system. It also has on there a red button called emergency. So if there's anything that's getting ready to come down, any major emergency or disaster type event, you can access it and learn more about it on the network of care. And sometimes that's a really good way to just kind of keep abreast of what's going on in the state. It's a really nice tool because the individuals who have mental illness can go on there and actually create their own folder in which they can list out all their medications, and this folder is secure. It's their folder, it's password protected. They create the password where they can list out all their medications. They can even develop their own personalized treatment plan on what goals they want to work on with their lives, and it all stays in this folder on there, and that folder can be accessed from anywhere because Network of Care is a web-based system. So if they're not in Maryland and they're in Hawaii somewhere and they can't remember a name of one of their medications, they can go online, go to their folder, go in their folder, and their med list would be in there so they could kind of help them out.
That's valuable.
Yeah, it's going to be, I think as we move along, we're hoping that more and more people will go online, go on the Network of Care, and just play around with it, and and look at some of the other states. It's an initiative that came out of California, and I know when I went on the California website, I not only found information about mental health, but I also found information about dementia, Alzheimer's, and it's written in a format that is very simple and plain English, whereas a lot of times when you look in medical literature, it's sort of complicated. Well, all this information is now very simplified, and so you can read about dementia, you can read about Alzheimer's, you can read about what is mental illness.
And more
What
importantly,
is-
understand.
Yes,
Yes.
yes. You can read up on your diagnosis. So if the
Yes.
doctor says you have schizophrenia, you can
You
actually
can
go
read
on
it.
the network of care and pull up schizophrenia, and there's a nice, clear, simple description of what it is.
How refreshing.